Hello, I'm Michelle Tapper with the latest from science. Around 1 in 5 Australians suffer from a mental health disorder, and as the COVID-19 pandemic continues, experts say mental health problems are only going to get worse. Joining us today to discuss these issues is Academy Fellow Professor Patrick McGorry. He's a psychiatrist and Executive Director of Orygen and Professor of Youth Mental Health at the University of Melbourne. Hi Patrick, thanks for joining us.
Thanks, Michelle.
Pat, mental health is often difficult for people to talk about, but at this point in the pandemic, it seems that nearly all of us are being affected, or we know someone who's being affected by anxiety or depression. What does the latest research show?
I guess the latest research shows a series of surveys mainly so far. That's the sort of research that can be done in a short time frame. It shows surging levels of distress and mental ill health across the whole population. Now, as with any disaster or crisis, there are variable levels of exposure of people to the crisis, but in this case, almost everyone's been exposed in some way, even though it's a bit variable still. So everyone is really more conscious and more personally and viscerally probably aware that mental health is quite fragile actually, and they probably knew that intellectually before, and obviously 5 million Australians every year are affected by mental ill health, so it was a widespread feeling before, but it's really gone to another level now, and I think that's worrying people quite a lot.
Now, there are varying degrees of mental health problems. What would your advice be to people who are suffering from general anxiety or depression?
Well, I suppose the first thing to say is that just because we're not feeling good and we've lost a sense of well-being and maybe we're more anxious and with lowered mood compared to our normal selves, it doesn't mean we all need to be rushing out to see mental health professionals. The majority of people are going to be okay through this disaster and crisis. However, a substantial minority will not be, and it's going to be a significant surge on top of what's normally the case. So the trick is really to work out when you actually need to reach out for help.